Go, go, that's a good catch. Come and go, 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 that was a good catch. Go, 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 that's a good catch. Go, go, that was a good catch.
Hello and welcome to a new edition of Inside Lincoln Hospital, the heart and soul of the Bronx. Today, we're going to be sitting down with Dr. Robert Pellecchia. He's the chair of dental medicine at NYC Health and Hospitals at Lincoln. We'll discuss what drew him to a career in healthcare and all the latest updates at Lincoln Hospital. Our conversation will also focus on a very common concern that many people deal with, that's dental hygiene. We'll touch upon when to visit the dentist and how to maintain dental health. I'm the Dr. Valvely from WBLS. Welcome to Lincoln. Welcome to BronxNet. This program is brought to you from BronxNet's brand new media and technology studios and NYC Health and Hospitals, Lincoln. Dr. Pellecchia, thank you for joining us.
Well, thank you for having me here today. And on behalf of Lincoln and my department, we're grateful for this opportunity to share the good things we're doing at Lincoln. So thank you for having us.
Oh, you're very welcome. Now, tell us a little bit about yourself, a little bit about your background and what initially drew you to a career in healthcare.
So I started, it started way, when I was back in high school, and, I progressed as time grew, but I was more of a jock in high school, and as I entered college, I went to St. John's for about a year and a half, and then subsequently to NYU. At that point, I realized my passion was for medicine, and so I pursued a career and went to NYU Dental School, and I continued on to practice to a resident education program in Montefiore Hospital. And believe it or not, I started my career at Lincoln Hospital, so I've gone full circle.
Sometimes it happens like that. It goes full circle.
It's very unusual, and I'm grateful for the opportunity to both start my career and hopefully end my career at Lincoln. So it's been quite a journey for me.
Yeah. Can you explain what that role entails and the responsibilities to manage all of that in your position?
As a chair, I've learned from many people throughout my career on the do's and don'ts of leadership, and you learn from everyone you meet. So for me, the thing that's most important in being the chair, wherever I've been, both before coming to Lincoln and now at Lincoln, is really to develop a good culture. And the culture is important because you want folks to have a buy-in of the vision of the department, of the leadership that's in place at the time, and that's critically important. So as my main function, really as chair, is to manage the staff and keep them happy, if you will, because when they're happy, it transcends to better patient care, and that's always seemed to be a good formula.
It's like a wife.
Exactly.
Happy wife, happy life.
That's very, by the way, that's very true. Yeah. So I learned that through experience as well. So, but at the end of the day, that's really what seems to be the formula for success for when you're in a leadership role, especially chair. It's a large department, a lot of subspecialties. So it's important to have buy-in from everybody in the department.
Yeah, it seems like there's a lot of subspecialties, a lot of cases. Tell us a little bit about the type of cases that you see at Lincoln Hospital.
Well, we're a full-scope maxillofacial surgery and dental department. We treat every form of oral condition, be it simple to the most complex. We have recently added subspecialties in all divisions. We have periodontics, which is for those patients afflicted with gum disease, 3 orthodontists, and a new brand spanking new pediatric resident education program. And today actually is the site visit for our final accreditation for our pediatric residency program. We're most proud of the program because Lincoln, in its entire history going back to the Civil War, has never had a pediatric resident education program. And we see about 3,000 children a year, so we're very proud of it.
Yeah. Wow.
Recently, from a maxillofacial surgery perspective, which is what I do, we have patients coming from all over the world. Actually, we have a patient recently who came, a 14-year-old who has complete fusion of his upper and lower jaw and has an inability to thrive. So we're going to treat that patient by surgically separating the jaws literally from the skull so he can open, because at the present time he cannot do so. And it's a complicated case. We're happy to offer that service to this young man.
And doctor, when you say inability to thrive, that means he can't eat correctly, open and close his mouth
He cannot open at all.
Speak?
He cannot open at all. So basically, he's been in and out of the hospital because he can't function. He can't open.
Yeah.
So he's had to be fed, through feeding tubes. And at this point, there's really nothing you can do for this young man other than this surgical intervention, which we will provide for him. It's a complicated case. We have all the specialty divisions at Lincoln. I have to shout out to my colleagues in pediatrics, Dr. Khanna. They've been a great help to us in terms of getting this patient prepared for surgery, along with our colleagues in anesthesia. So, complicated case. We're happy to do it. And we're one of the few places that can actually do this. So,
wow, that's great. Can you talk about the emergency room, dental services at Lincoln, and what they provide?
Well,
people, where do I go? I have an emergency.
Most patients, if they're not sure where to go, they'll go to the ED first. So throughout my career, I realized that patients really they don't know what to do. So what the first order of business is, they'll seek care at the ED.
Yeah.
So what happens is because we're the third or fourth or fifth busiest hospital in the country, Lincoln's ED is always very busy, but so is the outpatient areas. We had the good fortune of coming up with a plan. And again, we were the first I believe, in the New York tri-state area to do this, where we actually put a dental chair in the emergency department, so patients come directly to the ED, and so they do not have to go to the outpatient area. This mitigates long wait times, and it allows patients to be seen in an expeditious manner so that they're cared for. And I have to tell you, it's a big patient satisfier because patients now are treated very quickly, and we have an attending present, a resident, a full staff down there, and only one treatment room, but it's enough to see patients on a regular basis. I will tell you, last year we saw about 3,000 patients in the ED that would have otherwise either been turned away or gone to the outpatient area, creating a lot of congestion on the floor. So the patients love it, and it's been a great service for the patients.
My thing was, I have a pain. Let me go to the drugstore, get some Ambisol, then I'll make some phone calls.
Right.
But Lincoln Hospital has the
we
facilities.
we actually provide a good service for them. So,
yeah, that's great. That's great. What makes Lincoln's dental program stand out from all the others?
I'm going to be biased now.
There you go. It's okay.
At the end of the day,
understandable.
At the end of the day, we provide really services in all disciplines of dentistry and maxillofacial surgery. So. One of the goals that I had coming back in 2021 was to make sure that every patient, regardless of the complexity of their care, that we could perform the service that they needed. So as a result, we brought in multiple specialists, as I mentioned. We've had a total of about 11 specialists now that can provide a full comprehensive scope of services. And there's really nothing that we will not do, and if we can't do it, it would be extremely unusual. So any patient with any degree of complex care can be seen and treated by our department, and we can provide the care for them. So.
When should a child first see a dentist?
I had to confer with my pediatric team on this one, but actually, it's when the first tooth erupts.
When the first tooth erupts.
Or
it breaks through the gums.
Right. Or within 12 months. So then that's the point when the child should be seen.
So when they're teething.
Pretty much. Yeah. So it's really important that they're seen on a regular basis to prevent other things. Prevents more complicated care in the future. So yeah.
Are cavities and other tooth decay inevitable, or are there habits that
Actually,
we can develop to
actually
maintain?
years ago, I would have said it is inevitable, but not anymore, because I think with routine dental care and with all the treatments we have available, you can prevent a lot of incipient decay, and sort of as a preventive measure, you can take care of these before anything gets too further along in the process. So I would say it's not inevitable. It could be taken care of as long as you have routine dental checkups, which is, according to the ADA, about twice a year.
Yeah.
And that includes some imaging as well. So.
And stay away from candy and sweet drinks.
Invariably, people are going to do that anyway.
Do that and go right to sleep.
Within
Hide
moderation.
the candy under the pillow.
within moderation. So, but yeah.
Top doc at Lincoln, Dr. Robert Pellecchia. Thank you so much.
Yeah, my pleasure.
All right. We'll take a quick break right here. When we return, we will continue our conversation with Dr. Robert Pellecchia, the Chair of Dental Medicine at Lincoln Hospital. Stay tuned.
There's a new channel to explore, and it's bringing the classics back to life. During the day, relive the BronxNet originals that sparked conversations and built community. At night, dive into the hip-hop throwbacks that defined a generation. One destination, two powerful lineups. Now playing on Optimum Channel 952, Fios 2138, and streaming at BronxNet.tv. BX Legacy, where history meets the moment.
And welcome back. You're watching Inside Lincoln Hospital, the heart of the Bronx, with Dr. Robert Pellecchia. He's the chair of the dental medicine at Lincoln Hospital. Doctor, you know, it's always nice to grab all that, grasp hold of all that wonderful information from you.
My pleasure.
I mean, you got to come back more often now.
I promise.
Okay. Let's switch gears a bit and talk about dental care for young adults as they begin to explore habits like smoking, vaping, or getting oral piercings. How do these affect their teeth, and what long-term damages do they present?
Well, anything that changes the oral environment, the issues of smoking have been well documented, predisposes patients to oral cancers and other more aggressive types of lesions. But now with the vaping, I don't think we really know enough about vaping. We know it's not great. We know that it does change the oral flora as well. Yeah. So anything that they use will change the oral flora, which will not only affect the teeth, but the surrounding structures, which includes the gums and the bone that support the teeth. So it's never a great habit. I'm not here to personalize this, but I will tell you that it's something that does create a problem down the road if it continues, because there's no upside to how the oral cavity responds to this and the surrounding structures. So it's an ongoing issue for us, how we manage it.
But many young people think that if there's no pain, there's no problem. Should they still be seeing the dentist regularly?
Absolutely. The issue is that sometimes even when patients present with lesions, I remember not too long ago we had a 21-year-old, he was a basketball player too, and the only thing he noticed was he was having slight discomfort in his jaw, nothing too serious, but he had not been to, had regular checkups nor imaging for quite some time. We routinely take what they call a cone beam or a panoramic view of the jaws, which include the upper and lower jaw. And lo and behold, he had a large, fairly aggressive tumor. But at that point, it was only mild discomfort. One would not think there would be a problem. So sometimes there's insidious pathology going on that you don't know of, and it requires routine imaging and care. So the answer is they need to have that looked at on a periodic basis.
Yeah. So that was underneath the.
It was. You couldn't visualize it was in the bone, and it was a fairly aggressive tumor, which later required resection of the jaw. But again, if you don't see it soon enough, they just get larger and cause more damage to the jaw itself. So.
Yeah. Do wisdom teeth always have to be removed? They always tell you, you got to get that out of there because it disrupts the area or whatever.
So it depends. It depends. Depends on the age of the patient. generally you'd like to have them removed when the patient is younger because they're easier to remove. As you get older, they become more difficult, like everything else that happens to us, unfortunately. So if there's in the presence of pathology, meaning anything that looks to be suspicious, meaning, and I don't mean cancerous or anything like that, I mean cystic in nature, you'd want to have the teeth removed. So rule of thumb is generally when the patient is younger, it's easier for the patient to have the teeth removed almost on a prophylactic basis as a preventive measure. As you get older, and I would say mid-20s, you can have those wisdom teeth, if they're fully embedded in bone, looked at periodically to make sure there's no changes around the teeth, and then decide whether to remove them or not.
So they're susceptible to infection, or? They
are susceptible. So if they're not fully, if they're fully embedded in bone, generally they're pretty indolent, but again, they need to be looked at periodically because they can cause problems as you don't have a problem, do you?
No, I don't know. I still have one left, but I remember I remember them being taken out as a kid.
No, they're not sometimes very difficult to remove. It's not, but we have ways to allay any concerns of anxieties of patients that have to have them removed. So the answer is if they're fully embedded in bone and they're you reach a certain age, I would say mid-20s, you should have them looked at periodically. But they can cause problems because when they're not fully erupted, that's when they could become infected.
Yeah, I remember they put you to sleep back then. I think I had two of them taken at the same time. And I remember they must have put me in a room with a TV going because I remember the commercial that was playing in the background. New Ajax laundry detergent is stronger than dirt.
Yeah, I remember that commercial, by the way. So, we actually offer sedation services. So. So if a patient is, anxious, we can get them.
What should someone do if they have bleeding gums or tooth sensitivity? Is this a sign of something more serious, or can it be related to smoking or vaping?
It could be related to any of the above, and or it could be related just to gingivitis or beginning of periodontal disease. Yeah. I would say that if there's an abrupt change in the gums itself, and there's you see some changes of bleeding that you didn't expect to see, it warrants a visit to the dentist or periodontist immediately, only because you want to make sure it's not something of a systemic nature, meaning it's outside of just a local oral condition. So that would be something you'd want to look at. But in general, if there's bleeding, that means that there's some inflammation of the gums that should be looked at, and it does warrant a visit to the dentist.
How do you help eliminate the fear of that sound of the drill? Zzz. A lot of people are fearful of that, just like they're fearful of a microphone in front of their face. But this is like almost the same, but the fear of that drill.
It's, I think with the new technology, it's going to make a sound. Yeah. But we offer, we can. They use headphones now, and there's other measures that they use to. If a patient's really concerned about it, we will sedate the patient, and for relatively short periods, procedures, we can offer them that to get them through some tough procedures. If it's more extensive, and a full comprehensive care has to be implemented, at that point we may consider taking the patient to the operating room and perform, comprehensive services under general anesthesia. So.
Because there is that anxiety and that fear of going to a dentist also.
Everybody has it.
Yeah. So
it's normal.
So don't wait it out. Come and get it checked. You may have something that you may need done.
Yeah, absolutely. It's normal to have, it's very unusual. Listen, nobody's ever.
Even the doctor has fear of going to
nobody ever really relaxes. But we do the best we can to get people comfortable. So.
Is there a rule of thumb? How often should a person visit the dentist? What's the general recommendation?
The general recommendation is at least once a year, usually twice a year.
Yeah.
Again, because you want to, usually imaging once a year, or at least.
And cleaning and.
Yeah, absolutely cleaning twice a year. Yeah. And you can go to, most dentists have a hygienist, or I would recommend oral hygiene checkups every twice a year at least.
Adults have these fears. You've seen some of them on TV. Sometimes they're talking and the dentures fall out on the table there. What are some of the fears? Dentures don't fit well or are uncomfortable. What do you tell them?
You know, there are things we can do now to retain dentures, and we do a lot of that at Lincoln, and we've made the care so that patients can afford actually these procedures. What we do is we use what they call root form implants, and these are anchors that we place if the patient has appropriate amount of bone, and we place these anchors in the jaw themselves, and they can support these prostheses, the upper and lower denture, and it gives the patient a lot of retention, so they don't have a fear of the teeth coming out, and there's ways to secure the denture to these root form implants. It provides a lot of stability, which in the past, implants have been around a while, but as they're evolving, so is the technology, and it's become the level of sophistication keeps growing. So we use virtual surgical planning, as we say, and it's all done computer imaging, and we do that all at Lincoln. We have a 3D lab. So what we do is using the 3D lab, we can fabricate replicas of what the patient will receive, and we can use that as a form of a template for the proposed surgery. So there's a lot we can do to help patients that have loose teeth and dentures.
And
dentures.
The goal would probably to help them be able to speak well with the dentures, eat well, and
because patients become self-conscious if they look good, exactly. But if they become self-conscious because they're a fear of teeth falling out, it becomes a problem. We can help them with that.
Doctor, how often should a patient have their gums checked or their mouth checked for signs of disease?
The answer to that would be as frequently as needed. So as you progress, as you get older, you have to raise your awareness of oral cavity or diseases that affect the oral cavity, in particular periodontal disease. So by checking more frequently, you can mitigate any damage to the supporting structures of the teeth, which includes the bone and the gums. So when they become more inflamed as you get older, and this is a natural progression, it's prudent to seek dental care more often.
Yeah. And we were mentioning earlier off mic about the correlation between dental care and heart disease. What can you tell us about that?
Yeah, that's a good question. So recent studies, even going to JAMA, the Journal of the American Medical Association, there's a correlation now between in particular periodontal disease and heart disease. In fact, I will tell you, in many instances when patients require heart valve surgery, for example, whether it's aortic valve replacement, any particular valve, mitral valve replacement, many cardiothoracic surgeons, if not all, request that all offending teeth be removed prior to placement because of concerns of systemic infections following or the placement of the aortic or mitral valve. So there is a strong correlation now between diseases that affect the oral cavity and overall systemic health.
Wow.
Yeah, it's a big deal.
It is, it is. So here we go again. It's lots of great information. Why should people choose Lincoln Hospital for dental care?
You know, the answer for that is, for me, is simple. We have a great staff, and we have a staff that cares. And as I mentioned when we started, we have a good culture, and it transcends to good patient care. And there is, because of all the services we provide, we can really treat any patient with any particular need, and that includes from children now to the elderly and anybody in between. And from a surgical perspective, which is my passion, is we can provide care to patients that need even the most complex of cases. So.
The top doctor, Lincoln Hospital.
Proud of our department.
Dr. Robert Pellecchia, we appreciate you. Thanks for coming in. And be sure to come back and share more.
I will. Thank you, Dr. Lee.
Did we miss anything?
I don't think so. I think you did a great job.
All right. You did too. All right. Thanks, everyone, for watching. And remember, you can always watch Inside Lincoln Hospital, the heart of the Bronx, anytime, anywhere, on BronxNet.org and YouTube. And while you're there, be sure to follow Lincoln Hospital and BronxNet on social media to find out who will sit down right here in these fantastic seats so you can learn more. From BronxNet's Media and Technology Studios in the Bronx and the South Bronx, to get the music going. I'm the Dr. Bob Lee, and this is Dr. Robert Pellecchia. Thank you so much.
Thank you.
And I'll see you next time on Inside Lincoln, the heart of the Bronx. I was going to say the heart and soul of the Bronx. We'll catch you another day, another way. I love you all. Peace.
Go, go, that's a good catch. Go, that was a good catch. Go, that's a good catch. That was a good catch.